And an equally vexing problem in the Eastern Cape province. And that's where we find reporter Aviwe Mtila, who is in the Nelson Mandela Bay Metro. Aviwe, good afternoon to you. And the statistics that you're going to give us are fairly horrific.
Certainly, Jeremy, we had an exclusive look inside the public hospitals of Nelson Mandela Bay, and it's a cause for a huge concern. Government says that it's done all it can in preparation for the resurgence of COVID-19 in Nelson Mandela Bay, but the behavior of the residents have led to the public hospital beds, the casualty wards being full to capacity. Now, what's more alarming there is the mortality rate. You'd understand that public hospitals can't turn away any patients while the beds are full. So this leads to many of the people dying even in the corridors of these hospitals, as we found out that 50%, almost half of the people that go to those casualty wards pass away. What's more even shocking is that the people on ventilators, 80% of them do not make it alive. I just want you to listen to Dr. Kamlasha, the acting CEO of Livingston Hospital, as well as one of the doctors, Dr. Vish, at the Utenig Public Hospital, on how they describe the mortality rate.
80% of the people who go to ventilation ICUs, we lose them. We lose half of the people who come to our wards.
One of the examples, we had a lady, we had no beds or stretchers available. She passed away in a wheelchair, sitting in amongst a crowd of people in the respiratory area. There was a 13-year-old boy lying in the bed next to her, and another lady lying in another bed right next to her, also watching it as it happened.
And nurses, Aviwe Mtila, are desperate, I imagine.
You know, Jeremy, they came out in numbers just last Tuesday when the Minister of Health visited Livingston Hospital. They braved the rain, essentially just protesting outside, saying that they want to be heard. You remember, these are the frontline workers, saying that they're not being catered for, and in fact they are dying in numbers because of the COVID-19 pandemic. Now, in our exclusive look, when we went inside the hospitals there, we spoke to doctors that detail how they really are testing positive in huge numbers, and in fact the fatigue levels as well, considering that many patients are losing their lives, and junior nurses not being able to deal with all of this, saying that they need fresh legs. Let's listen to those conversations.
I saw a message now in our work group. I think the whole nursing team in neonatal ICU has tested positive. So that's an entire nursing team in an ICU that has to now be quarantined for 10 days.
It's extremely difficult for staff to stay in PPE and also to keep motivated. There's a very high burden of patients who are passing away and who are suffering. And it's very difficult for some of our junior staff to carry that and to carry that burden. So we actually need fresh legs.
The report from Aviwe Mtila. It's just after 1:30. This is Monday lunchtime.